Hello everyone, welcome to Great Online Training. Myself Nikita, and today we're going to discuss about unlocking opportunities in medical. So in this session, we're going to discuss about what is medical coding, different career opportunities in medical coding, salary packages, and about our course details and everything. Okay, so topics will covered in this class. Ayushi, please mute yourself.
Yes, ma'am.
Yeah, thank you. So today we'll see what is medical coding, roles of medical coder, career growth in medical coding, salary package for medical coder, what types of training do you need to become medical coder, that we'll see. Then we'll see why you need to choose great online training, and then lastly we'll see course objectives, overview, and course details. Okay. So, what is medical coding? What do you know about medical coding? Can you tell me, Ayushi?
Ma'am, as you have said earlier, that we convert some disease terms and
Yeah,
in the form of some alphabetical codes,
yeah, correct.
symptoms in some form of
Correct.
alphabetical codes.
Yeah. So, medical coding is, you can say in simple language, medical coding is conversion of complex medical diagnosis, medical terminology, and procedures into universally accepted numeric or alphanumeric codes. Okay, that is medical coding in simple language. So, in this picture, you can see that one person is typing, some mail exchange happen between them, and one person is providing services. One person, that is provider, means doctor, he is providing medical services, and another person is typing. So obviously this person is medical coder and this is provider. Okay, so medical coding is the process of converting descriptions of medical diagnosis, procedures, and other services into standardized numeric or alphanumeric. Okay, this is simple definition of medical coding. And when you go for your medical coding interview anywhere, this is the first question they will ask you in most of the cases. Medical coding is coming up as the most promising career today. The US healthcare market is blooming and companies are outsourcing their businesses to developing countries. So this means this industry is so vast and there are tremendous job opportunities in this field. Okay, and US healthcare market is, as this market is blooming, those companies are outsourcing their business to developing countries like India. So we have good opportunity to work with US healthcare industry. Okay, and most important and interesting thing about this industry is you can enter into this industry just after completion of your graduation. Simple BSc graduation is minimum qualification needed to join this industry. Okay, just a minute. That is very interesting part in this field. So medical coding jobs provide a rewarding career path with potential to develop to managerial and leadership positions in the revenue cycle department. So now we'll see what is the revenue cycle. Okay, it is also known as US Healthcare RCM. You can see here in this picture, one person is providing medical supplies, okay, and one person is paying. So RCM is this picture representing RCM. Okay, so RCM means revenue cycle management. Okay, it is the process used by healthcare system in the United States and all over the world to track the revenue from patient from their initial appointment or encounter with the healthcare system to their final payment. So RCM is cycle between US healthcare provider and the pair. Okay, this is the representation of RCM cycle. I'll explain this cycle in brief. Okay, so basically this is cycle between patient, provider, and payer. Okay, you can see here patient, provider, and payer. So what is provider? Provider is anyone who is providing medical care. Okay, or you can say who is certified to provide medical care, whether it can be MD, DO, or radiologist, pathologist, whoever it can be. Provider is the blanket term used to describe anybody who provides medical care and certified to give medical care. Okay, so that is provider. Patient is the one who receives medical care. We can call them as patient. Then the payer is this payer. The payer is insurance provider. Okay, so let me help you figure out how healthcare works in India versus how healthcare works in US. Once you understand difference, you will get clear idea about what we do. Okay, so in India, most of us we are not covered under insurance, right? Even if we are covered under insurance, what happen is you need to get admitted in hospital to avail that insurance benefits, right? Because outpatient services are not covered much in India nowadays. Few insurance provider giving this benefit also, they cover outpatient visits also, but in most of the cases outpatient services are not covered under insurance, and to avail insurance benefit we need to get admitted into the hospital at least for 24 hours, otherwise we are not able to use those insurance benefits, right? But in US that is not the case. In US almost everyone, even including children, they are all covered under some form of insurance. Why it is like that? Because cost of care, the level of care in US is way too high, right? All the processes are very costly in US compared to that of in India. So there almost everyone is covered under some form of insurance. Either it can be government insurance or private insurance. So what will be patient doing all his or her life? They will be paying some amount as a premium to the insurance company, and that is where payer comes in picture. Okay, so now I hope you learn all these three terms: patient, provider, and payer. Patient is the one who will receive the will suffering from any health issue and getting medical care. Provider is the one who is providing medical care and certified to provide medical care, whereas payer is either patient or, in most of the cases, insurance company is the payer. Okay, so in US healthcare, this is RCM cycle, which starts with appointment scheduling, then eligibility check and benefit verification, then actual encounter, then medical coding, then next step is charge entry, claim submission, clearinghouse rejection, insurance adjudication, payment posting, account receivable, denial management, credit balance, and patients collections from patient. Okay, so these are few steps involved in RCM cycle of US healthcare industry. What happened? First, I'll tell you what happened in India. You know already, but then too I'll tell you. Just give me a minute. Yeah. So when in India we facing any health related issues, so you are facing knee pain. Okay. So you have any health related issue. We'll take an example as knee pain only. Okay, you will call your doctor and schedule your appointment. Okay, or you just walk into doctor's clinic or hospital, which is an outpatient visit where you paid him then and there, right? He will give you your report and prescription. He will write your vital signs, reason for your encounter, what was your chief complaint, diagnosis and all. And finally, he will wrote treatment and drugs you receive or you have to take. He will provide you prescription. He will hand over your report to you and you pay him then and there, and so cycle ends here in India, right? In only in one day or in few hours. But in US, this is not the case. Their process is entirely different from our process. So what happened in US, even if it is small outpatient encounter, that is also covered under insurance benefits. Okay, so if any patient in US facing knee pain, suppose. Okay, so that first that patient will schedule appointment, call into the hospital and schedule their appointment and register themselves. Then the medical billing staff of that hospital check their insurance eligibility, okay, and benefit verification. Then actual encounter happens where patient walking into the hospital. Then that doctor asks him or her about her chief complaints or signs, symptoms, medical history, everything. Suppose that patient is suffering from knee pain. If needed, that doctor order knee X-ray to diagnose the uh, disease or cause of that pain. Okay, and what happened between the conversation between doctor and patient is being recorded either by audio or video. Okay, and those recording or conversation between doctor and patient, those recorded sessions are shared with insurance company. Okay, that's how the insurance company get to know what type of problem that patient is facing and what kind of services that doctor provided to the patient. Okay, so insurance company share that recording between doctor and patient, shared with medical transcriptor. Then medical transcriptor convert those audio recording into healthcare report. Okay, they listen to that recording carefully and make an expert assessment, or you can say medical report of that patient, which contains patient's sign and symptoms, the other procedure. Suppose knee X-ray was done, then knee X-ray, the information about that knee X-ray, the findings, any description and all, any diagnosis that also entered into that report. Okay, healthcare report. And then medical coder comes in picture, because after medical transcriptor done with their job, they make healthcare report. That healthcare report shared with medical coder. Then medical coder convert, first read that report carefully and select proper diagnosis. Suppose that particular patient with knee pain having knee effusion, okay, that or knee arthritis, suppose because of the knee arthritis he is facing knee pain. So our diagnosis will be knee arthritis. We need to code for knee arthritis only, not for knee pain. Okay, so medical coder select that knee arthritis term and select code for that term and enter that code into ICD section of the patient's report, or patient's, you can say, there is software to enter this course. Okay, he will enter that diagnosis into that software. Again, knee X-ray happen here, so we need CPT code for that. So he will be selecting the CPT code for knee X-ray and enter that code also into that report. That's how that report, which were previously 1 or 2 pages long healthcare report, that convert into just 2-3 codes, right? So that's how it is. That is simple. So medical coder convert that complex medical terminology, medical diagnosis into simple medical codes. And after that, medical biller comes in picture, because those medical codes bear some charges on it, some bill amount on it. So medical biller enter those medical codes into billing system, okay, and they generate medical bill for that patient. And then all these steps happen between this. If everything goes well, then that claim will submit and insurance payer pay to that doctor. If any problem or any issue happen in medical codes, suppose medical coder enter wrong code mistakenly, in that case denial happen or claim rejection also happen. Sometimes insurance company is not providing for or paying for certain procedures or certain diagnosis. In that case also claim rejection happen. So in that case, medical coder, that particular report goes back to medical coder, and medical coder has to check what is the problem of rejection and code that report again. This is how RCM cycle works in US healthcare industry. Do you have any doubt? You can ask me.
No, ma'am.
Okay, so we'll move forward. We'll discuss each and every step of this RCM in further sessions. Now I'll give you just brief information about it. So now we'll see roles of medical coder. Medical coder plays a crucial role in healthcare industry by translating complex medical information into standardized codes. They assign alphanumeric codes to diagnosis, procedures, and services based on patients' medical records. For diagnosis, we assign ICD codes, okay, which are for specifically for diagnosis. For procedures, we need to use CPT codes, or if inpatient is there, we need to use ICD-10 PCS codes. Okay, so again, inpatient and outpatient coding is different in case of procedures only, but diagnosis codes are same for each and every patient. Okay, so basically in medical coding there are so many specialties present. So after entering into medical coding field, you need to choose for any one specialty. Okay, these codes are used for various purposes including billing, reimbursement, research, and healthcare data analysis. Medical coders ensure that accurate codes are assigned, enabling healthcare providers to receive appropriate payment for their services and maintaining the integrity of the patient's record. The medical coder has to ensure that he or she will be entering accurate code for that particular diagnosis and procedure, so that the provider get their payment on time. And also medical coder has to maintain integrity of patient's record. They are not allowed to leak any information. When I join that time also, and even right now also, most of the companies are not allow phone while you working as a medical coder. We need to submit our phone before going on the floor. Okay, so now we'll see career growth in medical coding. These are different steps. When you join this industry, US healthcare industry, most of the people join it as a junior medical. Okay, there are other roles also in this industry, but right now we are discussing about medical coding. So if you want to be a medical coder, first you need to join as a junior medical coder or fresher. Okay. Then once you gain at least 3 months of experience, 3 to 6 months of experience, you will be promoted as senior medical coder. Then after gaining few months or few years of experience, you can become a quality assurance or quality analyst or QA. Okay, means you need to check reports coded by medical coder. So obviously to work as a medical QA, you need experience. Okay, because you are responsible for quality of medical coders coding, right? So that's why you need experience to work as a QA. Then next step will be team leader. If you have ability to handle team, to manage team, you can become a team leader. Most of the companies also provide on job training also to become a quality analyst, to become team leader or manager. Next steps are assistant manager, and senior. So salary expectations and career opportunities. Can I skip this slide? This is important.
Yes, ma'am.
Okay, I'm just joking. Yeah. So salaries for medical coders vary based on factors such as experience, credential, geographic locations, and work setting. This is a chart showing or graph showing the salary. When you join as a fresher, you can command for 10 to 20,000. Okay, fresher and non-certified. I'm saying, because in medical coding, there are so many certifications present. Okay, which are taken by American Association. Okay, so Even though if you are a fresher and non-certified, you can command over 10 to 20,000 salary. And if you are a fresher but certified, if you completed your certification before joining any medical coder job, you can become a certified fresher, and then you can command over 20 to 30,000 salary at the starting. Okay, and after gaining 2 years of experience, 30 to 40,000. Again, 4 years of experience, 40 to 50,000, like this. Sorry, but again, these salaries are depends on your experience, credential, and geographic location and work setting. If you are working in some specialties need, or some companies need you to work on night shift. Okay, so if you are working in night shift, you can command some extra money. Okay, you will get night allowance and all. Credentials means certifications you earn. As you gain more and more certification, you can command over more salary. But this is minimum salary you can start your career in medical coding. At least 20,000, 10 to 20,000 you can start as a fresher, non-certified. Okay. Again, geographic location, like mostly in South area, you can get more salary than in Mumbai, Pune area. And obviously, as you gain more and more experience, you can command over more salary. And specialty is also another part. Mostly inpatient coder command over higher salary than outpatient coder. Okay, but inpatient coder use ICD-10 PCS coding system to code procedures, and we are providing this course which is for outpatient coding. We are not providing a course for inpatient coding. Okay. Generally, certified medical coders command higher salaries due to their specialized knowledge and skills. So obviously, if you are certified, you will get more salary than non-certified coder. With experience and additional certifications, medical coder can advance their careers by taking a leadership roles, becoming coding educator or consultant, or translating uh, into related areas such as auditing, compliance, or healthcare management. So there are not just as a medical coder, there are so many career opportunities in this healthcare industry. Okay, now we'll see what types of training do you need to become medical coder. Do you have any doubt? You can ask me.
No, ma'am.
Okay. So first, educational foundation. The minimum educational requirement for most positions is diploma. You just need a bachelor's degree in science. Most of the company prefer science candidates only, but few companies also hire non-science graduates also. But if you are a non-science graduate, you need to learn, you need to take knowledge about human anatomy and medical terminologies, because obviously you need to clear the interview rounds. Okay, or you need to complete your certification if you are a non science background candidate. Then, while not mandatory, completing a program in healthcare information management, medical coding, or a related field can provide valuable knowledge and enhance job prospects. These are not compulsory, but it will enhance job prospects. Okay, but minimum requirement is bachelor's degree or graduation. Okay, so specialized medical coding training. Enroll in dedicated medical training program available through vocational schools, community colleges, or online institutions. Like like we are providing online training. You can join any medical coding training program to start your career in medical coding. Comprehensive training covers essential topics like anatomy, medical terminology, healthcare procedures, and the key coding systems, including ICD-10, CM, CPT, and HCPCS level 2. Okay, it's professional certifications. Attending professional certification is highly recommended and may be a prerequisite for employment. Few companies hire only certified candidates. Okay, but most of the companies also hire non-certified candidates also. Consider certifications such as certified professional coder, also known as CPC, offered by the American Academy of Professional Coder or APC. Okay, and we are providing training right now. We are providing training for CPC. We have another certifications also. Means in medical coding we have different certification, but currently our institution provides training for CPC certification only. Okay, the other certifications are like Certified Coding Specialists (CCS) provided by American Health Information Management Association (AHIMA). If you want to become an inpatient medical coder, you need CCS certification. Okay, Certified Coding Associate also offered by AHIMA, suitable for entry level roles. CCA and CPC, CPC taken by APC, whereas CCA taken by AHIMA, but both are at same level. Okay, both are entry level certifications. Most of the people prefer CPC certification. So right now we are providing training for CPC certification. Okay, and if you want to become a inpatient medical coder only, you can go for CCS certification, because they in CCS they covered ICD 10 PCS also. What next point is practical experience. Again, hands-on experience through internship, externship, or entry-level positions in healthcare settings. Practical application of coding knowledge in real-world scenario is invaluable. And soft skill developments, cultivate essential soft skills such as attention to details, analytical thinking, effective communication. These skills are crucial for accurately interpreting medical records and translating them into codes. Apart from that, you need to know some computer shortcuts and basic computer knowledge also. Okay, because ultimately you have to work on computer. So if you know key shortcuts and all, you can do your work fast. Now we'll see growing demand for certified medical coder. The demand for certified medical coders is steadily increasing in the healthcare industry. As healthcare providers strive to optimize revenue cycle management, ensure accurate billing, and comply with coding regulations, the need for skilled coders has intensified. The certified medical coders are valued for their expertise in assigning accurate codes, reducing billing errors, and maximizing reimbursement for healthcare services. Obviously, when any person clear their certification, medical coding certification, that person has good knowledge of medical coding. He or she knows each and every guideline of medical coding. Okay, that's why most of the company prefer certified medical coder, and a certified medical coder command high salary than non-certified medical. So now we'll see why you need to choose great online training for medical coding training program. This is the only training program which is comprehensive and affordable. We know how to train you quickly and efficiently and at your pace. As we are providing you online training, you can attend our training session anywhere you want. Okay, and even you miss any session, you can get recordings of that sessions also. So it is not compulsory that you need to attend each and every session at given time. You can use recording and learn about that particular session afterwards also. Get trained and ready for your new career in as little as 1 month to 3 months. Why 1 month to or 3 months? That I'll discuss in next slide. Lifetime access to study materials and recorded videos. Okay, you can watch our recorded videos anytime, and even though you will get study material also. We provide practice exams to help you build confidence and proficiency in medical coding. APC CPC certification exam guidance is also provided with medical coding career guidance and interview preparation. So these are a few points. That's why you need to choose great online training for your medical coding training. Now we'll see course overview. Well structured, our course is well structured program, intelligently put together under guidance of industry experts from same field. Okay, our medical coding training course is designated to equip participants with the necessary skills and knowledge to pursue a successful career in medical coding. The course aims to provide students with understanding of medical terminology, medical anatomy, physiology, as well as the different codings used in healthcare industry, including ICD-10 CM, CPT, and HCPCS. Okay, so you will get knowledge about each and every guideline of ICD-10 CM, CPT, and HCPCS. Our expert instructors will provide you hands-on training, practical exercises, and real-life case studies to ensure a thorough understanding of medical coding principles and practices. We'll provide you practical examination, examples, real-life case studies to ensure proper understanding of medical coding principles and practices. So our course objectives are understand the fundamentals of medical coding, develop accurate coding skills for various medical specialties, gain proficiency in ICD-10 CM, CPT, HCPCS coding system, interpret medical documentation and assign appropriate codes, apply coding guidelines and regulations, prepare for medical coding interview, prepare for professional coding certification exam. Okay, after completion of 3 months of course, you can go for professional coding certification exams. Rather than I can say you can go for CPC exam. So these are course details. We offer multiple batches to accommodate various schedules. Okay, so we provide morning batch also and afternoon batch also. Okay, so you can choose any batch according to your time. And even though you are not able to attend any session sometime due to any problem, you have recorded sessions also. Okay, you will get access for recorded sessions also. Each batch will consist of limited number of participants to ensure personalized attention and effective learning. Here are details of our upcoming batch. Duration 30 days for basic course. Okay. And 3 months for advanced course. So advanced course is for certification. After completion of this 3 months course, you can go for certification. 30 days course is just to enter into this medical coding industry, just to clear your interview. Okay, but if you want to clear CPC certification, if you want to go for CPC certification, you need to enroll for 3 months course. Okay, which we call as advanced course. And timings are we are providing Monday to Friday for 1 to 2 hours. Why 1 to 2 hours? Because some chapters need 1 hour, some needs 45 minutes also, or few chapters needs 2 hours or more than that also. But we divided such chapters into parts. Part two. Mostly will take it for 1 to 1.5 hours. Okay, and eligibility criteria. This course is for BMS, BHMS, BPharm, DPharm, nursing, or BSc, MSc life science streams. Okay, so anyone can join this. After completion of your graduation, you can join this. Anyone can join this course. Okay, now we'll see course contents. So basic medical coding course, which is of 30 days. Okay, please remember this, that we have two types of courses: basic medical coding course, which is of 30 days, and advanced medical course, which is of 3 months. And for certification, you need to enroll for 3 months course. Okay, so in basic medical coding course, which have 30 days duration, you can get understanding about basic business of medicine. Okay, you will get understanding about US healthcare industry, each and everything. Review of anatomy, human anatomy, medical terminologies, physiology, everything you will get to understand. Then overview of ICD-10 CM, applying ICD-10 CM guidelines. We have 21 chapters in ICD. ICD-10 CM divided into 21 chapters, and we'll discuss guidelines for each and every chapter. Okay, and also you will get introduction of CPT, HCPCS level 2 and modifiers. In the basic medical coding course, you will just get introduction about CPT, HCPCS level 2 and modifier. Why is it so? Because specialties are depend on CPT coding. Okay, CPT course are divided as a specialty. Means we have different part for different session for evaluation and management course. We have different parts for pathology course, anesthesia course, surgery course. Okay. Plus, so that's why we have given introduction to CPT, HCPCS level 2 and modifier in the basic medical coding course, which has 30 days duration. And in advanced medical coding course, which has duration of 3 months, which is useful for CPC certification. If you want to go for CPC certification, then you can enroll for advanced medical coding course. Otherwise, basic medical coding course is also sufficient to clear your interview. So in advanced medical coding course, it covers basic medical coding course 30 days. It will start with basic medical coding course only. Okay. Plus, apart from basic medical coding course, you will get understanding about HCPCS. This HCPCS course set is useful for medical coding supplies coding, like wheelchair, ambulance, and everything, or injection, any drug provided coding. Then also we have different topics. I discuss with you in CPT. Evaluation and management, anesthesia, surgery, integumentary system surgery, musculoskeletal system, respiratory cardiovascular system, digestive system, urinary male genital system, female reproductive system, maternity care and delivery, endocrine system, nervous system, and spatial senses like ocular and auditory. So we have surgery sessions also. We'll cover surgery session, radiology CPT coding, pathology and laboratory CPT coding, and medicine. So in advanced medical coding course, you will get basic medical coding course also, plus this all the CPT chapters. It means in advanced medical coding course, you will get knowledge about CPT, ICD-10 and HCPCS, everything. And in basic medical coding course, you will get thorough understanding about ICD-10 CM plus just introduction of CPT and HCPCS. Clear? Now we'll see fees. For 30 days, which is basic medical coding course, we charges 10,000 plus GST. For 3 months, which is advanced medical coding course, which is for CPC certification, is 25,000 plus GST. Okay. And if you enroll for 3 months course, after completion of 3 months course, please remember this, after completion of 3 months course, not 30 days course. After completion of 3 months course, candidate can apply for APC CPC certification. Exam guidance will be provided, okay, who are aspiring for CPC certification. Okay. But please remember that certification exam expenses are not included in this course fee, in this 25,000 fee. This 25,000 is just for course, not for exam fees. Okay. Expenses for APC certification ranges from 60,000 to 65,000 depending on USD conversion route. So if you want to go for CPC certification, you have to enroll into 3 months of course. If you just want to start your career as a medical coder and clear your interview round, you can enroll for 30 days of medical coding course. If you have any doubt, you can ask me now. Any question?
No, ma'am.
So what do you think about it? How is the session? Can any suggestion?
That was informative.
Okay, thank you. And
Yes, ma'am.
for which course you want to join?
Yes, ma'am.
Yeah. So thank you for your attention and thank you for attending this session. I hope it will be helpful for you. Bye bye. Take care.
Yes, ma'am.
Have any doubt? You can go on this site also, or you can contact on this number. Thank you.
Yes, ma'am.
Take care.
Thank you.